The majority of chronic kidney disease is related to high blood pressure and diabetes. It usually happens later on in life. Polycystic kidney disease, however, is passed from generation to generation. The genes that are associated with polycystic kidney disease are the PKD1 gene and the PKD2 gene. When there is a derangement in these genes, the cysts in the kidneys form. The actual mechanism for the cystic formation isn't exactly clear. The PKD1 mutation is thought to be the more severe mutation. It usually ends up resulting in a faster decline in kidney function over the lifespan of the individual. PKD2 mutation is a bit more mild. A lot of these patients end up developing chronic kidney disease, and the progression to end-stage kidney disease may happen later on in life in their 6th or 7th decade. So that's the big difference. The autosomal dominant genes are passed from family member to family member. Usually when there is an autosomal dominant condition, one parent has to have the gene in order to pass it on to the next generation. So if my mother had the gene and my dad didn't, I would have a 50% chance of getting autosomal dominant polycystic kidney disease. When it comes to recessive genes, each parent needs to have a copy of the gene, and when the copy of the gene is passed from both parents to the individual, that results in an autosomal recessive condition, and that's about 25%. Back 10, 20 years ago, a lot of patients weren't followed very carefully. They were told by their doctor, you can come back to me when you need dialysis. And that's very, very disheartening from that time. And now we have so much more information. We can pretty much take treatment to the next level for really reducing this progression and hopefully preventing end-stage kidney disease. We may not be able to prevent chronic kidney disease, unfortunately, but if we can keep patients off of dialysis and ultimately, hopefully, if they develop severe chronic kidney disease, get them to transplant first, that would be better for everybody.